Hello, and thank you for watching this video, as it will provide you with a brief introduction on how to obtain skinfold measurements using the 7-site skinfold method. The use of skinfold measurements can be a helpful tool to track changes in body fat distribution that may occur with training. Calculating skinfold prior to training can provide the client with useful information on how effective their program is and provide numerical information about their change in body fat composition. Skinfold measurements are very practical and limited equipment is needed in order to estimate a person's body fat percentage. The only materials needed to perform these measurements will be calipers. The calipers will be used to measure the thickness of subcutaneous fat. Keep in mind that this test will only show a prediction based on the principle that the amount of subcutaneous fat is proportional to the total amount of body fat. However, subcutaneous fat varies with sex, age, ethnicity, and gender. Other factors that may contribute to measurement error within skinfold assessments include poor technique and inexperienced evaluator. Extremely obese or extremely lean subjects will increase standard error, and improperly calibrated calipers. The following procedures help standardize the skinfold measurements. Firmly grasp a double fold of skin, a skinfold, and the subcutaneous fat between the thumb and index finger of your left hand and lift up and away from the body. Be certain that you have not grasped any muscle in this procedure and that you have taken up all the fat. However, be sure to have the subject relax the area prior to the measurement. You should grasp the skinfold site with 2 fingers about 8 centimeters apart on a line that is perpendicular to the long axis of the skinfold site. You should be able to form a fold that has roughly parallel sides. Larger skinfolds, obese individuals will require separating your fingers further than 8 centimeters. Before conducting the skinfold measurements, these guidelines should be followed. All measurements should be made on the right side of the body with the subject standing upright. Calipers should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skinfold, and halfway between the crest and the base of the fold. Pins should be maintained while reading the caliper. Wait 1 to 2 seconds before reading the caliper. Take duplicate measures at each side and retest if duplicate measurements are not within 1 to 2 millimeters. Rotate through measurement sites or allow time for skin to regain normal texture and thickness. The following sites are where the measurements will be located and conducted. The abdominal site is a vertical fold 2 centimeters to the right side of the umbilicus. The triceps is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and olecranon process, with the arm held freely to the side of the body. The chest pectoral is a diagonal fold 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. The mid-axillary is a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. The subscapular is a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. The suprailiac is a diagonal fold in a line with the neutral angle of the iliac crest taken in the anterior axillary line immediately superior to the iliac crest. The thigh is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Be sure all weight is shifted to the left side when conducting the measurement to the thigh. Place the tips of the calipers on the double fold of the skin and fat. Release the scissor-like grip of the caliper claws while continuing to support the weight of the calipers with the hand. Record the reading on the caliper scale 1 to 2 seconds after releasing the scissor grip lever to allow the jaws of the calipers to measure the skinfold site. Measure the skin fold to the nearest 0.5 millimeters. Measure each skin fold site at least twice. If duplicate measurements are not within 1 to 2 millimeters or 10%, retest that site. Sum the mean or average of each skin fold site to determine percent body fat. You can use specific skin fold equations to determine body density and percent body fat. The 7-site skin fold formula will be used to calculate the estimated body fat percentage. After you have conducted the measurements for the 7-site skin folds and applied it to the equations, you can compare the results to the following charts by age and gender to distinguish your level of fitness. Thank you for watching, and I hope you enjoyed my video.